This is Speaking of Pets podcast, where we offer you up-to-date, science-based, accurate information.
Oh, Gizmo. Good kitty. You're such a good kitty.
And they're looking up and howling in unison.
If it affects pets, we'll talk about it. Speaking of Pets podcast is sponsored by Vetromax Solvacare Gel, the industry-leading treatment for idiopathic hyperkeratosis. Available from your vet or visit Chewy.com and save 15% with promo code VETROMAX15 at checkout. Vetromax makes it better. And Blue Buffalo Veterinary Diets. Love them like family, feed them like family. Hey everyone, welcome to Speaking of Pets. I'm Dr. Alice Novotny-Jeroman, a board-certified veterinary dermatologist, and
I am her sister, Janet Novotny-King. I am not a board-certified allergist, veterinary dermatologist, all that stuff. I am a pet owner and lover, and I'm Dr. Alice's sidekick, aka I'm her Ed McMahon. Welcome to the show.
Welcome. You know, Janet, I've always said if we can't keep our pet parents healthy, we can't keep the pets healthy. And
True.
This idea of One Health, meaning the diseases that pets get, that we get, we need to communicate about those. Yep. So today we're very fortunate to have Nicole Bell, who is the CEO of Galaxy Diagnostics and the author of What Lurks in the Woods. Mm-hmm. Nicole is a graduate of MIT and Duke, and she's oh yeah, what would Daddy say? Smart cookie. But anyway, Nicole is a graduate of Duke and MIT and has had personal experience with tick-borne disease, specifically Lyme, not only in a human, but also in pets. Mm-hmm. And being CEO of Galaxy Diagnostics, they have developed a new way to test for Lyme in humans because it's all about the test.
Right.
If you're tested and you're tested negative, but you still have it, the longer you have it, the harder it is to treat.
Happened to me. I know y'all are sick of hearing it.
Living proof, and thank God you're living proof of it.
Absolutely. And you know, the title of her book, What Lurks in the Woods, you see me, like sometimes I'll be walking on cement and going into grass and I'm like, oh no, I know there are ticks there. Like you get a little crazy once you've had it because they're everywhere. They're not just in the dry leaves, they're everywhere. They're in stone walls.
And thankfully we have tick preventatives for our pets, for the cats and dogs. Mm-hmm. But as humans, we're not as lucky to have that. Mm-mm. So I think it's very important that Nicole's on the show today because, again, these diseases that our pets get, that we can get, are very important. And I love the marriage of veterinary medicine and human medicine in trying to solve these diseases and the diagnoses of these diseases. So welcome, Nicole. We are so honored to have you today.
Can't wait to hear your story. Thank you for joining us.
Your furry friend's health and happiness is paramount. And while most pets are generally healthy, they may sometimes develop hyperkeratosis, a condition which is characterized by an excessive buildup of keratin proteins on the nose and paw pads, which causes the skin to become thicker than normal. Vetromax Solvacare Gel is a quick-drying, greaseless healing gel for the cracked skin of the nose and paws for dogs, cats, and even horses. With proper care, hyperkeratosis is highly manageable, and Solvacare Gel is the industry-leading treatment with ingredients like salicylic acid producing skin turnover and urea, which holds in moisture. This clinically proven patented formulation is the country's #1 veterinarian recommended solution for idiopathic hyperkeratosis. Vetromax Solvacare Gel takes less effort to yield maximum benefit. Today, our podcast listeners can try Solvacare Gel with an incredible 15% off at Chewy.com by entering promo code VETROMAX15 at checkout. Order today at Chewy.com and save 15%. Hey, did you know that Blue Buffalo makes prescription diets that are formulated by animal nutritionists and veterinarians? And they're used for dietary needs such as kidney support, gastrointestinal support, weight management, and our favorite, allergy and skin problems. They make a food allergic diet that's an alligator-based called NP or a hydrolyzed salmon-based for dogs and cats called HF. So please ask your veterinarian about Blue Buffalo prescription diets. Hey, welcome, Nicole. We're so glad you joined us today.
Oh, I'm so happy to be here. Thanks for having me.
Janet, I know
Yeah.
you're dying to ask her
What?
about your Lyme disease.
Oh, well, we're not going to hear about my Lyme disease, but tell us about the title of your book and how you got to the title and the story behind it.
Yeah, so the title of my book is What Lurks in the Woods. And it's really about my family and my husband's struggle with tick-borne illness.
Mhm.
And that was a whole journey, which I'm sure we'll go into. But the title of the book was really, obviously, ticks. They're what lurks in the woods. And I am now completely paranoid every time me or my kids go outside, and we spray constantly and tick checks and so forth. But the other thing that I think came out, and the other, impetus for the title was I didn't realize with tick-borne disease how much mental health issues that there were and all of the associations. And as part of my husband's journey, he started hallucinating. He started having all sorts of actually, his first presentation was really more neuropsychiatric symptoms, nothing of which I attribute to tick-borne illness.
Mhm.
And as part of the journey, as his condition got worse, he started thinking that there were people in the woods that were trying to kill us. And, he thought there were people with machine guns and snipers and so forth. I mean, the hallucinations. And I realize now, the more patients that I talk to, this is not an uncommon thing. Hallucinations, both visual, audio, audio. The mental health component with tick-borne disease is big. And so, so that was the kind of where the title came from, because it was literally the woods were this ominous thing, not only for the actual threats, but the perceived threats that came about from the illness. And so the book just tells our journey, from the beginning of how the symptoms erupted, how it impacted our family, what it was like to be a caregiver, and then, how we evolved through that process.
I will
I
say,
was
having
impressed.
been a victim
sorry,
of Lyme disease, I fear, like, my husband goes out to blow the leaves, or I go out to rake, or I garden, and I put on permethrin as my drug of choice or chemical of choice. But I literally spray. You do get a little paranoid about,
Yeah.
I'm going for a walk later with my friend in a woods that's kind of paved, but I will still spray. And I guess what I found really interesting about your book was that both, humans and animals can get tick-borne diseases.
Mm-hmm.
But it seems like we're doing a little more. I know my dog is protected, but I can't take preventative medicine, right, Alice? Unless I'm wrong, right?
Right, right. We have our pets on flea and tick preventatives, which carry tick-borne insects or tick-borne disease. But it's so sad that human medicine almost seems a little step behind, including in diagnosis. I mean, isn't it true? I read in your book, Nicole, which was, I have to tell you, I was in tears at the end. I don't know how you managed to live the life you did, living with someone that really was failing neurologically, and you had 2 children. It's just amazing to me. But getting back to the diagnosis, that was striking to me, because when he was first tested, he only tested 1 out of 5 bands. Could you
1 out of
go
5
over
bands. Yeah. So, the standard of care for Lyme disease testing, if you go to your doctor and you get a test as a human, is either a standard 2-tier or the modified 2-tier. Everything's kind of moved more towards the modified 2-tier. So the standard 2-tier is an ELISA first step. And then if you test positive for that, there's a Western blot. And that is looking for kind of protein bands. It's an antibody-based test. It's looking for antibodies to Lyme disease. So it's not looking for the pathogen itself. It's looking for your immune system response to the antibody or to the pathogen, sorry. And then the modified 2-tier is a 2-stage ELISA. So at the time, we had him tested with the Western blot, and in that criteria, you have to have 5 bands be positive in order for it to be considered a positive result. And he only had 1. And, at the time that, the doctor said, well, he doesn't have Lyme disease, he has something else, you should go to a neurologist. Now I know, now I work in the diagnostics industry and I'm trying to figure this out and solve this problem. It's really just a flaw in the testing, because it's looking for your antibodies, and antibodies are your immune system response. And One, I think the best time to treat tick-borne illness is early, and antibody testing takes 4 to 6 weeks. So you're missing that optimal window in order to get, early treatment when the antibiotics are the most effective. The other thing is, research in animals has shown time and time again that there's different behavior and patterns of immune response. And some people and some animals, they look, there's amazing work done at Tulane University on rhesus monkeys, which are really the best models for humans. And they show completely different antibody profiles. And some of the monkeys don't express antibodies at all, right? Even though they've shown to be infected with the disease. And then also another confounding effect is people that are sick for a really long time, like my husband, they have suppressed immune responses. And so they have low antibody titers overall. And so, in my husband's case, if you looked at his total antibody, just as antibodies to any pathogen, right? Mm-hmm. They were lower. And so the fact that he didn't test positive on an antibody response is really not surprising, because he had been sick for a matter of years, even though I didn't realize it. And he wasn't sick per se, where you would look at him and think, hey, you're sick, but he was having these symptoms that now I realize were linked to tick-borne disease. And so antibody testing is just fraught with challenges, because it's based upon the host, where you're infected, their response. And as we know, we're all different. We all have different comorbidities. We all have different genes. We all have different exposures. And so it's really not the best testing. And so that's what a lot of people don't realize. They go to their doctor, they get tested, they think they're negative, and then they move on to something else. Meanwhile, they've, gotten a false negative, and that's exactly what's causing the root of their symptoms. And that was what the case was with my husband, Russ.
And isn't it important to be sure your doctor is using the right lab? I mean, aren't some labs better at testing than others? And then I'm aware that Galaxy came out with a urine test.
Yes. And this is kind of on the other side. So, I guess spoiler alert on my story, my husband didn't survive, right? He ended up passing away because we got diagnosed too late. Frankly, I think these pathogens are stealthy. They infect, really sensitive tissues like your brain. And so if you don't treat early, then it becomes more difficult to actually treat the infection. And so on the other side of that journey, I've been working my entire career as an entrepreneur. I'm an engineer by training. I like to solve problems. And so I'm like, okay, there's a massive problem here, right? I like to fix stuff. I like root causes. I like answers. And I hadn't gotten any in my caregiver journey. Like, it was just the most frustrating experience I ever could have imagined. And so on the other side, I had worked in my last half of my career has all been in the medical field and diagnostics, medical devices. And so I was like, okay, the diagnostics problem is the biggest problem, because if you don't know what you have, how are you going to get an accurate diagnosis, right? And we all know ticks, right? They don't just carry Lyme disease. They carry Bartonella. They can carry Babesia. They can carry Ehrlichia, Anaplasma, viruses, all sorts of different things. And so you really need to know exactly what you have, because guess what? The treatment for Borrelia is different than the treatment for Bartonella, which is different from the treatment for Babesia. Mm-hmm. And so if you don't know which one you have, your physician is basically flying blind, because a lot of the symptoms are nonspecific and they overlap. And so I started researching all the different labs that are out there. And I said, okay, diagnostics is the right problem to solve, because that's the beginning, right? You're never going to get a good treatment if you don't know what you have. And researched all the standard of care, the different labs out there. And I came across Galaxy and Dr. Breischwart, who I know that you all interviewed on a previous podcast. And what they were doing is really trying to solve what I consider to be the right problem, which is direct detection. Right? You don't want to have to rely upon the immune system. A lot of the techniques that are out there, even some of these, very popular specialty labs, they're still just looking at better ways of doing antibody testing. But that's not the challenge. The challenge is really understanding if the pathogen is there or not, because antibody testing, again, it's an immune response. And if I've been exposed to the pathogen, then the antibodies can be positive. And so not only do you get a lot of false negatives, but you can also get false positives, because just because, I have antibodies to COVID, right? But that doesn't mean that I have COVID right now, because that's how your immune system works. And so direct detection is actually looking for direct evidence of the pathogen itself. And so at Galaxy, we do that with some of the pathogens through blood-based DNA testing. But Alice, as you mentioned, for Lyme, actually blood-based testing isn't the right answer. So Borrelia burgdorferi, the pathogen causing Lyme disease, doesn't like to be in the blood. It hides in tissues. It's very immune evasive. And so one of the defenses that it uses to evade the immune system is it spits off all these surface proteins. And the reason it does that is because any antibodies that you do have will bind to the surface proteins that are spit off as opposed to the pathogen itself. It's actually kind of brilliant, right? And then those antigens aggregate and get filtered through the bladder and secreted in your urine. And so we use a urine antigen test where we capture and we concentrate those antibodies, and then we can use that, and that will tell you, okay, is the pathogen present or not? And so it's a direct test because that antigen is specific to Borrelia, and it gives you just much more accurate diagnosis, and you can also get it earlier in the infection, which again, that's when you want to get the treatment is as early as possible.
So can our listeners, so say they suspect maybe, I haven't been feeling well, maybe I have Lyme disease. Can they go to their physician and ask for the Galaxy test? How does this work?
Yeah, so it's available to physicians. I think sometimes it's challenging to get from primary care physicians just because a lot of those folks tend to make sure that things that they can go through the LabCorps and the Quests of the world. We're going to get there, but we're not there right now. Right now, the easiest place to get some of our testing is working with like a functional medicine provider or maybe a more alternative provider that's a little bit more open to newer methods. There's, Lyme literate physicians that really understand the complexity of this space. And I hate to have to recommend that because a lot of times it's hard to get an appointment and they're complex and it's more expensive, but that's where we are as part of today. Galaxy's mission is to it's not just to offer better testing, it's literally to change the standard of care.
Good.
Like the standard of care right now is broken. Everybody acknowledges it, right? Mm-hmm. Even the government and the CDC and the FDA, they kind of know that this test is not what it needs to be. But we need to change it and we need to provide better alternatives. And that's what we're trying to do. So you can get access to it. And, if somebody has an interest and has it, we have resources and folks, things on our website that can help and get people to the right place.
Good. Because that's the hard part.
And in your book, and I know in Dr. Phillips's book too, they mentioned that a person that has Lyme has been to a minimum of 10 to 20 doctors before it's diagnosed. That is amazing to me. I mean, to have all these symptoms and they're so variable.
Yep.
And to feel that no one can help me. Yeah. I'm not, no one, first of all, no one's listening to me. And then no one can help me. It's such a feeling of despair.
Yeah. I mean, the gaslighting is real. It really is.
And believing in you. Like it's gotten to the point now when I go, unfortunately, my internist retired and now I'm searching for a new internist. And I'm hesitant when I go in, like, I had Lyme disease. Like, do you believe me? Because a lot of them don't. And I had to go, I thought it was Herxheimer's effect when I had Lyme. And I had to go to the emergency room. And I remember looking at the ER doctor, which had like the big Darth Vader mask on because it was COVID. Yeah. And I looked and I said, are you a believer in, I asked him first, do you believe in Lyme disease before I started my spiel?
Well, and you're in Connecticut. How can he not?
Yeah. I know.
But did he?
He did. He goes, I get it. I get it. And and I had to list what I was, the antibiotics, because at that point I was being treated by a Lyme doctor. But you have to find those that believe. And again, it was my sister, the veterinarian, and my chiropractor who were the ones who diagnosed it. And I had been to 4 doctors at that point.
Yeah.
Nicole, why do you think as a veterinarian, I can draw blood, which I'd rather do the urine test for dogs because then I don't have to stick them. But why does it seem to be easier to diagnose in a dog than in a human?
I don't know if it's necessarily easier to diagnose. I think they have different tools, so a lot of, if you go in the veterinary space, they're using the SNAP 40X, which is more of a lateral flow kind of point of care assay. Those are good for looking at antibodies and seeing if there's an exposure, but it's still antibody-based testing, right? So it's still going to miss potential cases. I think that it's just more accepted in the veterinary community. I mean, and our pets are really our front line, and and that's how Dr. Breischwart got into human testing, is because he's a veterinarian, right?
Mm-hmm.
And you see it. Our animals are on the front lines of this war on tick-borne illness. But what he saw was he was seeing all these veterinarians were starting to get all these symptoms, right? And then people would just come to him after the talks and say, "Can you test me?" Right? Because I have all these issues. And so that's really how the journey into human medicine began. And as he's done more and more research, he's realized, hey, these pathogens are associated with really complex chronic illness, right? And some conditions like schizophrenia, I mentioned mental health. Like there's a lot of data that shows Bartonella is a huge indicator of schizophrenia and psychotic behavior. There's all sorts of stuff also on Lyme disease and mental illness and what that leads to. And even just most recently, some of the mechanisms for that were published. And so I think that it's just an evolving space, and it's hard for physicians, especially primary care physicians, who are generally the people that you go to when you have a tick bite, to stay up to date. And so one resource I would point people towards, because I think it's something I wish that I had when I was a caregiver, is before I started working for Galaxy, I worked with the Center for Lyme Action. And the Center for Lyme Action is an advocacy association or group that works with, to lobby for more federal funding for tick-borne disease research. And so they had requested that I write a paper called The State of Lyme Disease Research. This is something that they wanted to basically use with congressional staffers to show all the research that's been going on in the Lyme space, kind of get at what you're saying, Janet, of like, people don't think this is real. Let's show them all the amazing research that says that science says it is. Right. But we need to summarize that in a way that is approachable, because guess what? Most congressional staffers are not scientists. Right. And so they need to be able to understand it. And so that was what we did. And so we put together kind of a summary, and there's lots of figures and there's some things that I think is useful for the patient who's trying to navigate this space. And so they feel better about the gaslighting because it's real, right? And then two, I think they can also provide it to their physician and say, hey, you may want to get up to date on the latest in Lyme disease research, because guess what? There's an immense amount of research that's come over in the last 10 years that, politely, you may not be privy to, and you might, love to dig into a little bit further. And so anybody can find that on the Center for Lyme Action website. There's the paper, there's a webinar that we did, and I would encourage people to use that, because I think it's something I wish I had access to as a caregiver.
Sure.
Janet, I think you would agree with this. Several guests that we've had on the show, including Nicole, Dr. Latosky, Dr. Sivula, people that have gone through something like this are so inspired that they end up dedicating their life to helping others that have had this. Like, for example, Dr. Latosky ended up buying a hyperbaric oxygen chamber for her house. Janet, you wanted to buy one of those freezer things.
A cryovac.
Yeah.
Cryo tank.
But I mean, it really marks you where you think, I never want anyone to go through this again. Yes. Whether it's our pet or a loved one. And that's why I admire you, Nicole, for really dedicating the rest of your life after living what you went through. And by the way, I did buy a copy of Dr. Phillips's book, Chronic, for my own physician. Now, whether he read it or not, Dr. Maybe, if you're watching, make sure you read that book. I'm going to quiz you next time I see you.
Well, actually, it was you reading that book that had you diagnose me. And then I gave that book to my internist, and he was like, he was on my side, though. He totally agreed, Yeah. So it's a very good book.
Well, I think part of it too is the good old boy network. Like, for example, my doctor's affiliated with University Hospitals in Cleveland. We have UH and Cleveland Clinic. They have their set labs that they're going to use. And no matter how much I beg, can you do this urine test from Galaxy Diagnostics? It's too much work for them to set up with another lab. And I disagree with that, because I had accounts as a veterinarian with whichever lab I thought was the best at doing the best job. It doesn't cost you anything to get an account with a lab. So
yeah, setting up an
unfortunately-
account is super easy, and it's actually easier for the patient because you know a lot of offices don't have phlebotomy, and this is just a urine sample. We'll ship it
That's true.
directly to your house. You pee in a cup, you mail it off, and you get
Easy
the results.
peasy.
You know, 2
No
weeks
pun
later.
intended.
Yeah,
Right.
Easy.
Yeah.
easy peasy.
I actually
I
had
like
a
that.
phlebotomist. My chiropractor recommended. She's a traveling phlebotomist that came to my
There
house.
you go.
Yeah.
That's
Yep.
how I was able to send mine off to a different lab, but that was the lab I had available, right?
Yep.
But she came to the house. I mean, it was a lot of self-discovery. We had to kind of figure
Now-
everything out.
Nicole, when your husband had all these symptoms, you had mentioned in the book that you think your dog was having symptoms as well.
Yeah. So, you know, honestly, I think both of my dogs were suffering from Bartonellosis. So I talk about, in the book, I talk about my dog Radar, who actually passed as part of this whole journey. And he had a massive tumor that just kind of came out of nowhere. And now that so cancer, and now that I've been working with Dr. Breichwart, I realized that actually there's an association. You know, Bartonella is one of those weird little bacteria, can get into cells and it can take over, you know, a lot of the cellular interactions. And that's one of the primary things that makes something an oncogenesis or a cancer target. And so they've actually shown that in canine hemangiosarcomas, they have a high percentage of Bartonella. And so I wish.
I'm amazed by that. I asked Dr. Brightsford about that too. And I just, because hemangiosarc kills so many patients, and that's what your dog had, hemangiosarc?
Yeah. So, and
the-
I wish that I had a piece of that tissue. Like if I'd known what I know now, I would have.
know.
So that's kind of a think, not a
Yes.
no. But the other story that I have more evidence on is I had my second dog with Sonar, and Sonar. We had Radar and Sonar.
Radar and
My
Sonar.
husband- My husband liked names. They have big ears. They're rat terriers, right? And so that was why we had those names. And Sonar started developing completely different symptoms. And again, this goes to speak to the complexity of tick-borne illness. So he had symptoms more like Parkinson's. So he would just like his leg would randomly shake. And we would go to the veterinarian and the vet was like, well, he's a small dog. He's just, you know, nervous and anxious. And I'm like, no, this dog has never been anxious. Right. And it happens when he's sleeping. Like his leg will just be going. It was like literally like a Parkinsonian type thing. And because I was learning more about these pathogens, I was like, you know, hey, I would like you to get him tested for Bartonella, because there's a lot of links between, you know, Bartonella and neurological conditions and seizure activity and other types of things. And so, and actually, believe it or not, because I live in North Carolina, my vet was trained at NC State by Dr. Breichwart.
Yes,
and
by
so
Dr. Breichwart. Yay.
Yeah, by Dr. Breichwart. So he didn't think I was crazy. So I was
Yeah.
thankful for that.
Yay.
And so, so they took the sample and they sent it in and he tested negative. And I was like, okay, you know, this was NC State. This was Ed's lab, you know, but it was, you know, several years ago. And then his symptoms kept progressing. It ended up becoming, he ended up having symptoms of like doggy dementia. And I ended up having to put him down.
Mm-hmm.
And so, you know, now I work with Ed and I was talking to him, Dr. Breichwart, Ed. I work with him and I was like, you know, Ed, this was a story. We were talking about family members and I'm like, this is what happened to Sonar. And I was just always convinced, I'm still convinced that like, you know, he had Bartonella because it just didn't make any sense. He was a younger dog. Like he was 11 when he passed, you know, but rat terriers typically, you know, can live to 15 to 17. Yeah. And so, well, he was like, well, when did you have him tested? And did you have the lab results? And I was like, yeah, I mean, let me pull up the records. Sure enough, he's like, because we bank our samples. And so let me see with some of our latest technology, right? Because this was several years ago and they've developed a lot in advance since then. Let me see if we can retest it. And so, and again, I think before he was tested just with antibody-based methods. This time they tested him with the direct method, which in this case is a culture and a PCR, really advanced PCR technique. And sure enough, he tested positive for Bartonella. You know, I already put the dog down, right? So there's nothing I can do. Right. But it's like, you know what? Dang it. Right? Like I knew it. And so things like that, you know, it's just, so I know that my dog had it also, you know, my son had Bartonella symptoms.
I was going to ask you about your kids. Yeah.
So as far as I know, my daughter, I have two children. So, they're 14 and 11 now. And at the time, my son started exhibiting symptoms as early as 5 or 6. And he had one known tick bite. He also had a cat scratch, which, if you Google Bartonella, you get cat scratch fever, right? Because, but he got scratched by a barn cat. And I did know about Bartonella at the time. So I rushed him to the urgent care and said, I want antibiotics. And they looked at me literally like I was a crazy person. But they gave it to me. They called, it was my friend's mother's cat, and they actually called animal control. And I was like, no, don't send animal control and take her cat away. I was I'm like, lots of outdoor cats have Bartonella. I know you don't know this, but it's actually a thing. You can't take away all the cats in Chatham County. Anyways, he started exhibiting again some of these neuropsychiatric symptoms, OCD, anxiety, and and then because I knew what I had known because of my husband, I would have never ever have seen and connected the dots if I hadn't been through that journey with my husband. And that's what scares me, because I see a lot of other parents now working at Galaxy where their kids are in crisis. And but because I knew what to look for, I saw the symptoms. We actually didn't put him on antibiotics because his symptoms were still more mild. We put him on some herbal therapies that have been shown to be effective for Bartonella. And he was on that for 6 months. He did beautifully. And all of his symptoms went away, right? And he's been doing great. And so I'm super thankful for that because it's just one of those things that, like I said, I would have never connected the dots otherwise, and who knows where we would be.
Does your pet suffer from brown tear staining on the skin under the eyes? We see this in any breed, but especially on the faces of those cute little white fluffy dogs. This tear staining can lead to a crusty, painful, difficult to remove discharge. Tris Opto Eye Wipes can help. These wipes contain Tris EDTA, which is effective against porphyrin and any invading bacteria that may accompany the porphyrin. For routine eye discharge prevention, ask your veterinarian about Tris Opto Eye Wipes. Let's keep those cute faces even cuter. Your furry friend's health and happiness is paramount. And while most pets are generally healthy, they may sometimes develop hyperkeratosis, a condition which is characterized by an excessive buildup of keratin proteins on the nose and paw pads, which causes the skin to become thicker than normal. Vetramax Solvacare Gel is a quick-drying, greaseless healing gel for the cracked skin of the nose and paws for dogs, cats, and even horses. With proper care, hyperkeratosis is highly manageable. And Solvacare Gel is the industry-leading treatment with ingredients like salicylic acid producing skin turnover and urea, which holds in moisture. This clinically proven patented formulation is the country's #1 veterinarian recommended solution for idiopathic hyperkeratosis. Vetramax Solvacare Gel takes less effort to yield maximum benefit. Today, our podcast listeners can try Solvacare Gel with an incredible 15% off at Chewy.com by entering promo code VetramaX15 at checkout. Order today at Chewy.com and save 15%. From your book, I appreciated that there's so many different ways to treat these tick-borne diseases. It's like no two people does the same therapy work for. Like with your son, herbal, that was great. And I know with your husband, you tried herbal along the way there too.
I tried everything with my husband, trust me.
What were some of his first symptoms?
So really, again, his symptoms were all more on the neuropsychiatric side. So the first symptoms were more mood-based. So he was like the typical, type A, go-getter, really energetic, extremely social. All of a sudden, he was exhibiting depression, anxiety, mood swings, rage, right? And all the things when they first started manifesting, frankly, I just thought he was being a jerk. I'll keep my cuss words to myself for now. But, I thought he was just, he didn't like our life change. He had kind of retired to take care of the kids and be Mr. Mom. And I was like, please, dear gosh, go back to work. Like something's not working. Right. And so we tried therapy, but nothing was ever working. And it just kind of progressively got worse. And then I started realizing that he was losing his cognitive function, right? He was a brilliant engineer, electrical engineer and computer scientist, graduated from Georgia Tech, extremely creative. All of a sudden computer scientist, right? He could literally write code. He has patents, like 28 patents all over the wall of his office because he's just brilliant. And all of a sudden he couldn't remember the 4-digit code to our house alarm, right? Or the time to pick up the kids from daycare. And I'm like, what is going on? Right. And
What
so
made
I
you
started
think Lyme. What took you over from he's crazy to
it was when he started having memory issues because, again, he was brilliant, right? And he all of a sudden couldn't remember basic things. And at first I thought I was being crazy because he was like the standard argument you have as a husband and wife, right? He'd be like, well, you never told me that. Well, yes, I did. No, you never told me that. Yes, I did. And I'm like, what the heck, right? And it happened over and over again. And then, like I said, when I realized he was forgetting basic things, that's when I was like, he's literally forgetting, and this is not like him. And so I started researching just brain fog and, memory loss and other things. And one of the things that came up was Lyme disease. And my husband was a huge outdoorsman, right? He grew up in Georgia. He was a Southern boy. He loved to hunt. He did all the landscaping at our house. He has lived all over the country, right? Georgia, Texas, New Jersey, New Hampshire, California. I mean, literally lots of the endemic areas. Many, many tick exposures. And so for me, I was like, well, that makes perfect sense, right? Like that makes sense. And so, but again, as we already talked about, we went to the doctor and he tested negative. And we didn't go to just a PCP, primary care physician. We went to an integrative physician kind of that ran a whole battery of labs. But if you talk to anybody who's experienced tick-borne illness, they'll at least have one doctor that said, all your labs are normal, right? We don't know what's wrong. And so she referred us to a neurologist because all of his symptoms were neurological and cognitive. And that was when, he did some basic, cognitive testing. And I sat there in the room. It was an all-day thing to do this cognitive test. And I sat there. I talk about it in the book. And I watched him, and I was flabbergasted. Like, he was failing basic tests that I think he was about first grade at the time, that he could have done, right? And I was completely enthralled because, again, this man was brilliant. And I realized how bad it had really gotten. And they told me that it was either one or two things. It was either a stroke or it was Alzheimer's. Wow. And I, again, was flabbergasted. He had an MRI. I honestly never thought that I would be rooting for a stroke, but I was. But his MRI came back normal. Then he had a PET scan, and then the PET scan characterized him as having late stage Alzheimer's disease. Late stage. So I was still figuring out something was wrong, and they were saying that he was in the late stages of decline. And I think that is a testament to how devastating these pathogens can be. And, but I didn't know it at the time, and I was trying to figure it out. And we went to neurologist after neurologist, and I kept looking for other answers, right?
So no one ever brought up that it could be Lyme.
Nobody not a single neurologist. I had him tested for like HIV and syphilis, other things.
Right.
Funny, syphilis is a very cousin bacteria to Lyme disease, right? And they mentioned those, but that, never mentioned Lyme disease. And I had the negative test results. So it kind of went off of my radar because I'm like, well, that's not what it is.
Oh, right.
And he had no genetic predisposition. He was young, all the things, right? And it was another family member getting accurately diagnosed after her symptoms, where it was my sister-in-law and my brother was the one who was like, you know what, you need to get him retested by a better lab. And, and then that was when we figured out that was the root cause. And, now, like my dog Sonar, right, I donated Russ's brain to science, and I have images of Borrelia in his brain tissue, right? So hopefully that will be published in a paper sometime soon. And Dr. Breischwart has samples, and he's looking for other pathogens. But, to your point, Alice, about, it puts you on a mission, right? Because it's like you shouldn't have to have an autopsy in order to get the answers, right? Patients need better answers.
What do you say to the people? Because I've seen this argument. For example, let's go back to Bartonella in the hemangiosarcoma tumor in dogs.
I have a question. What's a hemangiosarcoma? That's a type of
tumor.
cancer.
a
Okay.
blood tumor that affects the spleen or the heart or the liver.
Is
Yep.
that what
And
Shaggy had?
yes,
Okay.
yes. And it ruptures and the dog will just die in front of
Yeah.
you. But anyway, Nicole, I'm curious. It's people that say, well, we found Bartonella there, but we don't know if that was the cause or the result. And
Yeah.
the fact that you're finding it in, at least what Dr. Breitschwert said in his paper, in so many dogs with hemangiosarc and in the ones in the heart as well,
Yeah.
it has to be connected.
Yeah, and I think a colleague and dear friend of mine, Nikki Schultek, wrote a beautiful post on LinkedIn that I won't be able to do justice. But it's basically like, when you think about is something a cause or an effect, right? You have to take into account, does the agent, right? Like if you see, what was the analogy she used? Like if you see somebody, there's been a robbery, right? And you see somebody in the backyard. That doesn't necessarily mean that they committed the crime, right? But if that person is a convicted felon, is holding, some chain, some big, what's the thing that I'm looking for?
clippers?
Bolt cutters,
Yeah.
to get into the house, and has
the
got a
money
ski
bag.
mask on,
Yeah.
right? Then you might be a little bit more suspicious that this is what's going on. And so the point is that these bacteria have all the tools to cause the immune dysregulation and dysfunction that is exhibited by these complex symptoms, right? And if you think of something like dementia and Alzheimer's disease, right? Alzheimer's disease is an accumulation of plaques in the brain. That's all it is, right? It sounds like a very specific diagnosis, but at the end of the day, they don't know why those plaques are there. And actually, researchers at Harvard have shown that those plaques are actually part of our innate immune response, right? And so this has been documented. And it's like, so what is our innate immune response? What is our immune system responding to?
Good
Right?
point.
Usually our immune system gets worked up over a couple of different things, either a pathogen or some sort of toxin. And so that's the key, is like you need to, maybe the reason why a lot of these anti-amyloid beta therapies haven't worked, trying to get rid of the plaques from the body, is because it's too far downstream. And what's upstream that we need to worry about, which is the pathogen or the toxin and the actual thing that's causing our immune, to be dysfunctional. And so it is a tricky argument, but at the same time, you really have to just use that. And then you have to do more studies. And that's really why I loved working with CLA, because CLA is like, look, we don't have the answers. All we're asking for is more money to go do the studies, right? Like you're giving billions of dollars, for example, for Alzheimer's research. Why don't we divert some of those to looking at pathogenesis of the disease and the role of microbes, right? Similar things in mental health, right? We're spending all sorts of money addressing kind of the mental health crisis in America. Why don't we look? And we have all sorts of examples and case studies now of people that actually have pathology in some of these bacterial infections. Why don't we look at this in more detail?
And to me, if there's a physical reason for something, why wouldn't you look for that first before putting someone on an antipsychiatric drug? It just doesn't make sense to me. Okay, it's easy. Okay, here's some tofranil or amitriptyline or something like that, or Prozac. When let me do some tests on you to make sure this infectious organism isn't causing all of your problems.
Yeah, and one of the stories that is joyous but also heartbreaking, right, is and this is one that Dr. Breitschwert has published on, is the story of a young boy. So at a young age, 14 years old, sudden onset symptoms of psychosis, right? He became homicidal, suicidal. He thought that his cat was telling him to kill himself and his siblings, and his parents were at a loss. They had to institutionalize him for fear for their lives and that of his own. They spent over $400,000 on psychiatric care, $400,000, and he wasn't getting better. All the treatments, nothing was working, medicating him to the point where he was literally drooling, right? And just no results. Fortunately, a healthcare worker noticed, Bartonella also often comes with these striae, right? Which are they look like stretch marks. And they often get attributed to that, but they're not. They're kind of, your immune system's response. And a healthcare worker noticed that and said, hey, I think you should get tested for Bartonella, connected him with Dr. Breitschwert, got him tested positive for multiple strains of Bartonella, got treatment with the appropriate antibiotics, and all of his symptoms went away.
Oh,
And
thank God it's normal. Oh,
this kid who was institutionalized, all of a sudden, all of his symptoms, his hallucinations went away. You know, he went back to high school. He graduated valedictorian of his class, and then he went on to college, right? And when did all of his symptoms, this, you know, again, this is a podcast about pets. When did all of his symptoms start? They started with the adoption of a cat, right? So cats are carriers for Bartonella, and they carry it in a bacteria. They're like over 6 orders of magnitude higher in their blood. And if you've got a cat that, you know, has been outside and has these issues, you know, you have a flea infestation, then you can transmit these, you know, these bacteria. And that's when his onset of symptoms occurred. And so, but most people don't know, most people don't think of this. And so, you know, I really wish that in a lot of these mental health scenarios, we just investigate our pathogens, our microbes, a potential root cause. Because I think even if the number is 10%, right, which I think is higher, but even if it's 10%, that's a huge amount of people where their lives, I mean, this kid went from institutionalized to back to like a productive member of society. I mean, what's the impact of that on his family and all of his future interactions, right? It's huge.
I mean, that is, it's so, how can I say, it's so monumental, and yet it's elementary. You know, it doesn't compute to me that someone, that a physician doesn't do a test for something that can be fixed, as opposed to try this, try that, try this, try that.
Yeah.
But anyway, Janet, I can't tell you. We could talk to Nicole. I mean,
I know.
And Janet, I'm getting you her book for Christmas. Even though you're going to cry at the end. I did, Nicole, and I couldn't put it down because I'm like, oh, now we know what happens, but I didn't know at the time that I was reading it.
Yeah.
So Janet, you have to ask her our question.
Oh, well, okay, wait. But I'm sitting here and I'm thinking, you know, for the average Joe like me who doesn't have a medical education, I'm not an engineer, so my brain doesn't work like that. But when you know as a patient there's something wrong, and you have to be your own advocate and keep, you know, I just kept going doctor to doctor to doctor, and like being on the phone with the receptionist going, you've got to get me in. You know, this is really bad. Like you have to get,
They all say that. All the patients say that.
But like, I don't know, you just have to be your own advocate and keep questioning.
Yeah.
You know, it's just kind of sad, especially for someone like me who's a lay person, you know, and
sad.
I just remember,
I know. I mean,
cats, and they're all through my body. And I remember almost being creeped out. Like, where are they? You know what I mean? Like, it's just terrifying.
Well, and what I say to people, because I think a lot of people are intimidated, right? You go to a doctor and they tell you something and they say, nothing's wrong with you. Everything's fine. And I like to remind people is like, you might not be an expert on medicine, but you're an expert on you. And you know what normal is, and you know what your symptoms are. And symptoms are basically just your body saying something's not right. And if you ignore it, or you dampen the symptoms with, a lot of doctors just like to say, oh, you know, you have inflammation, we'll give you an anti-inflammatory. You know, you have pain, we'll give you a pain medication. It's like you're just dampening the symptoms. It's like I used to work in, you know, robotics, and I would say the analogy I would use to my engineers, it's like, you know, if you have a robot arm and it's shaking, right? You don't just put a big weight on it and slow it down, right? You'd be like, well, why is it shaking? Is it the software? Is it the mechanics? Like, what's going on? You fix the root cause. And I just don't think that that's the way medicine is set up. It's like, you know, you have 15 minutes. It's, you know, a pill for every ill. And it's just, it doesn't work in the context of chronic disease.
And isn't there a study that said in the first 2 minutes, most physicians made up their mind about what's wrong with you? So there goes the listening out the window. You know, I would always tell my pet parents, listen, you live with him or her, with this pet. You spend what you tell me is vital, because I'm just seeing him for 30 or 60 minutes. But what you're telling me is more important because you live with him.
Yeah. And I used to keep symptom logs and, you know, and detailed notes and ask questions. I mean, those were some of the tools I used as a caregiver, because it's like, I'm not going to let somebody talk me out of the fact that something's wrong here.
That's right.
Right.
That's right.
It was clear. And, you know, I think the further we got down the road, it was like, you know, it was clearly evident. And again, there's a root cause, right? He was a healthy individual that all of a sudden was losing his mind. Like, there's got to be a reason for that. Something's wrong.
Yeah.
All right, I have to ask our guest question.
Oh, okay. Go ahead.
What, there's 2 questions actually. First one is, what has inspired you, and I think we know the answer to this, to do the work that you do?
Yes.
Yeah. it really is to prevent other families from going through the same journey that we did. I mean, I can't bring Russ back. I was able to help my son, I'm able to help a lot of friends and other people. And now through Galaxy, I can just help anyone who, gets a test. And we receive, wonderful stories from physicians that we work with of just, patients that they couldn't diagnose previously that we help with. And so that's what fuels me, right? Is trying to make sure that somebody gets the answers that they deserve and they don't feel gaslit by the medical system.
So true.
And our second question is, what is your pet peeve? And it can be about animals, pets, or humans.
Oh, geesh, that is a
Like
good
what
question.
just gets,
I don't think much phases her because I don't know how she put up with what she put up with.
Yeah, I don't either.
I mean, I think you just have to do what you do. You get thrown in scenarios. I think once I was out of the scenario, I had that same feeling. I'm like, how did I live through that? How did I live through that?
Sometimes you just do.
Yeah. I mean, I think as a person, I tend to be pretty straightforward and pretty open. And so I think, I guess a pet peeve would be people that obfuscate and aren't direct and tend to really just not say what's on their mind, but confuse the situation, or just like, I like to get to the heart of things.
Time for that.
The bullshit syndrome.
Yes.
Give me bullshit. Just tell it like it is.
Yes. As I've gotten older in my career, it's like, the no a-hole policy, right? Like it's there's no tolerance for that, right?
That's
like
right.
Especially now in my family environment and in the company, it's like, look, we're on a mission. Right?
That's
We're going
right.
to change the standard of care for tick-borne diseases. We don't have time for infighting. We don't have time for nonsense. Like, you're either on the bus or you're off the bus. Yeah. Right. And there's nothing personal about
Amen.
that. And so I think that's the thing is just getting to the point in your career and your life where you're like, hey, if you don't want to do this, that's great. There's a bajillion things you can go do, but this is what we're doing. And we'd love for you to help. But if it doesn't fit, that's fine. So.
And Janet, we're going to have a link to Galaxy Diagnostics.
I was going to ask you. And also we need a link to the book. Where people
the book. And Galaxy Diagnostics has a wonderful newsletter that it's just put your email in, and I love it. I just love the new findings that you guys are making all the time.
That's great. Nicole, thank you for the work you do.
Yes,
to help
we
everyone.
love
I
you.
appreciate it.
Yeah. Thank you. No, thank you for the opportunity to talk to y'all and share our story. And because I do think people need to be looking for this in their pets and their family members. It's
absolutely,
the exposures are real and they're way more common, and they're not just in the Northeast. It's everywhere. So the more people that can be aware of and see the signs, the better off we'll all be.
Thank you.
Amen
Thank you so much.
Well, all Janet, let's wrap it up.
She's taking our picture. Our producer.
Anyway, this is Dr. Alice Novotny-Jeroman, one of the Cleveland Novotny sisters, and
Janet Novotny King, one of the Cleveland Novotny sisters, saying thank you for listening. Don't forget to like us, follow us, share us, and let us know what you're thinking. We appreciate you. Thanks for listening.
Have a great day. Bye-bye.
Thanks for tuning in today. We hope you learned some valuable information about making decisions about your pet's health.
And don't forget to follow us on social media and subscribe on podcasts, because we love to have those likes. Thanks so much for listening.
That's actually really good.
Oh,
you
good.
could both go bye-bye.
Bye-bye.
You know? Yeah.
How about woof woof?
Speaking of Pets podcast has been sponsored by Vetramax Solvacare Gel, the industry-leading treatment for idiopathic hyperkeratosis. Available from your vet, or visit chewy.com to save 15% with promo code VETRAMAX15 at checkout. Vetramax makes it better. And Blue Buffalo Veterinary Diets. Love them like family, feed them like family.
Follow us on social at Speaking of Pets and listen wherever you get your podcasts.
The Speaking of Pets podcast is an SLA video production.